This is temporal bone of left side. The zygomatic process lies anteriorly, almost horizontal. The external acoustic meatus lies laterally. The squamous part is thin and it lies laterally and above. The styloid process is a thin bony projection and it lies downwards. The temporal bone has four parts: the squamous part, tympanic part, styloid process, and petromastoid part. The At first I will discuss about the external surface. The external surface, here there is attached the temporalis muscle. Here is a groove. This is called the groove for the medial temporal artery. This is the supramastoid crest, and this is the supra aquistic spine, suprameatal spine, and this is the suprameatal triangle. Now the internal surface. The internal surface, there is anterior and posterior division of the medial meningeal artery. Now the zygomatic process. The zygomatic process has anterior part and posterior part. In case of anterior part, there is superior border, inferior border, anterior surface and posterior surface. In the lower border, there is masseter muscle. There are four masseter. There are four muscle of mastication: temporalis, masseter, medial and lateral pterygoid muscle. Now the posterior part. The posterior part has superior surface, inferior surface, anterior border and posterior border. The superior surface has the tendon of the temporalis muscle. The inferior surface, it forms the floor of the anterior floor of the mandibular fossa. There is an anterior tubercle. Here is attached a ligament, lateral temporomandibular ligament. Now the mastoid part. The mastoid part, there is external surface, internal surface, and superior border and posterior border. In the superior border, external surface, there is a foramen. It is called the mastoid foramen. Here passes the mandibular emissary vein and the occipital artery. And there is a notch. There is a notch. It is called the mandibular notch, mandibular process and mandibular notch. In the mandibular notch, there is the posterior belly of the digastric muscle. The anterior belly is attached to the mandible, and the first arch of the pharyngeal nerve supplies there, and here supplies the second arch of the pharynx. Now the internal surface, there is a groove, sulcus. It is called the sigmoidal sulcus, and here lies the sigmoidal sinus. This is the superior border, and this is the posterior border. In the superior border, it is attached to the parietal bone, and the inferior border, it is limbus type of joint, and this is attached to the occipital bone, and it also forms the limbus type, and this suture is also limbus type of suture. Now the border of the squamous part, the superior border and anterior inferior border. The superior border, it is attached to the parietal bone. It is a to form a squamous suture, and this attached to the greater wing of the sphenoid bone. Here is formed the pterion, the four muscles, the parietal bone, sphenoid bone, squamous, and the frontal bone. So pterion, and here is asterion, 3 muscle, 3 bone, parietal bone, temporal bone, and occipital bone. Now the petrous part. The petrous part has anterior border, posterior superior border, anterior border, superior border, and posterior border. Anterior surface, posterior surface, inferior surface. The anterior border, it is attached to the greater wing of the sphenoid. The posterior border, here is the superior petrosal sinus, and the inferior border, there is the inferior petrosal sinus. In the anterior surface, there is trigeminal impression, there is trigeminal ganglia. In the here it is a elevation, it is called the arcuate eminence. This eminence is formed because of the superior semicircular canal, and there is tegment tympani. It forms the floor of the medial ear cavity. And this is the posterior surface. There is a meatus, it is called the internal acoustic meatus. Here passes the 7 and 8 cranial nerve, which is facial and vestibulocochlear nerve, and internal auditory artery. And this is the posterior inferior surface. Here is a foramen, this is called the internal, here is a foramen, here passes the internal carotid artery. So this internal carotid artery enters from here, and it exists from the apex. So it is internal carotid canal. And this is the jugular, and this is the jugular process. Here is the jugular vein. Now this is the styloid process, it is 1 inch long. This is the, here we can see a foramen, this is called stylomastoid foramen. Here passes the facial nerve, exits the facial nerve and occipital facial nerve and stylomastoid artery. So the facial nerve enters from the internal acoustic meatus, and it exists from the stylomastoid foramen. And now the ossification. The squamous part and the tympanic part is intramembranous, and the styloid process and petromastoid part, it is intramembranous, intracartilaginous. So it is a membranocartilaginous ossification. Thank you.